So, hi, Mr. Bhoopendra. I'm Dishant. I'm the Chief Technology Officer at Sterling Hospitals. I had all tech initiatives, clinical initiatives on the tech part, as well as the overall data compliance for the company and the CISO part. Today, we have gathered to, have a brief discussion regarding EMR, the buzzword, typically how EMR has evolved from a legacy system entry based system to a voice AI enabled and a handheld pads to structured data encryption in the EMR database. Uh, Overall, the patient care has evolved from a handwritten description to everywhere the compliance and the need for a EMR, because the way the point of care moves is not just at the patient prescription, but what are the interventions on the pharmacy, lab, radiology, and the convergence to OP to IP and matrices. That is how the entire EMR journey has evolved for the clinicians. Your thoughts, sir?
Hi, I am Solanki, CIO for Sakra World Hospital, Bangalore. Yes, Dishant very well said. The EMR, it's a transformation from paper to electronic mode of the prescription. And yes, it was a buzzword, but now it's converting to reality. And even our NABH also pushing to pushing all healthcare in the India to come on the EMR part. So it's not a easy task because this solution we have to penetrate to doctor community where they are very much familiar with the pen and paper. So we are working on that, and maybe we'll see the transformation soon.
Great. So, I think the first question which the panel has decided for us are the hurdles we have faced during the implementation of the EMR. I'll start with my core experience. First and foremost is the education of the masses. I think first and foremost is the education and the overall process redefining, explaining to the front office department, doctor assistants, and the doctor itself, the group of doctors, top surgeons, top doctors, clinicians, what is going to be the impact, and actually ensuring, what can be the modes, because typically medicos are very a resistance is there to type somewhere, something you can write in 1 minute, and you have to type it to the system. But now the products have evolved to a voice AI dictation, which makes it very easy that you can on the dictaphone, and then it goes into the system. So I think first and foremost is the education, the confidence you give to the clinician, the impact of the solution. The biggest strength is the historical data availability that a clinician gets in his practice once they move to EMR, the historic records of the patient that they get to see, right? I think the challenges mostly are on the trust we build with the clinicians and the staff there. Second part is the how good reliable IT infrastructure we provide to them, because it's not just limited to the patients who are coming as a walk-in patients. It also goes beyond the hospital settings. Typically, teleconsultation happening from the hospital. Doctor needs to be enabled with a good audio video facility, and the same getting recorded in the EMR and a prescription to be sent to the digital media to the patient. So I think these are the bigger challenges. I think the providing the best of the class IT infrastructure to the doctors, education, training, and retraining. I will have your thoughts, sir.
Yeah, well said. Because EMR, it's not a kind of only software solution. It's a complete gamut where this culture need to change from pen and paper. Technology also involved, because if you don't have a latest technology, then doctor is unable to feed, or if they want to teleconsult from their room, so those are difficulties are there. Also the speed, like pen and paper, their own speed depend, but here speed coming to the computer part means technology, if speed is not there, that also challenge. Second thing, we faced in the Sakra, patient is saying doctor is looking towards this screen only, not seeing the patient. So how to mitigate means how to reduce the click in the technology so that doctor spend less time on the computer side and maximum side to the patient. Apart from that, before all those things, even before implementing of EMR, we have to make them understand what exactly we are going to do and what we are going to achieve from it. In terms of compliance, one is separate part. Apart from that, like data, now everybody knows this AI works on data only. So strength of data, or we can say fuel of data, of any process is the data. So digital data will be there with the patient in form of prescription, reports, and their clinical notes, discharge summary. They don't need to bother about like they are have to carry this much big file to the doctor whenever they are visiting to hospital. So patient side also there is a comfort if data getting fed in digital form like EMR. And doctor side, doctor also no need to worry. System itself showing the trend. Like last year he visited, this much value was there. Now it's a trend going to increase, or it's a sine wave kind of, or decline is there in the progress. All those things are available in a glance. So it help in the clinical practices as well. So that portion we have to make them understand. Apart from that, the patient visiting, consulting, and going back to the home, whatever doctor advice, like medication, all those things, really those reach to the respective department so that we can help or guide the patient what they have to do. So those things are challenges which we have to mitigate. Few already we mitigate in the Sakra. Still there is, it is a journey kind of, because technology change and doctor demands change. Sometimes they need a order set, sometimes they need a favorites. All those things are continuous journey. But yes, timely, we have to change the refresh the technology timely, we have to adopt the new technologies. Like recently this conversational AI came into the picture, where a doctor no need to type even single character. Just they have to click start conversation with the patient, and then that conversation, once it is finished, they click submit, and it's segmenting like chief complaint, doctor assessment, doctor advice, investigation, medication. It is showing in one page, single pager. Doctor can have a glance, everything is fine, submit, finish. So 98% time going to the patient, not to the computer. So all those things are, we have to work together. Clinician, management, junior staff, everybody has to work in sync to achieve the that goal, EMR goal.
Great, very well said, sir. Very well said. I think the game has altogether changed from the data entry into system to system being smart enough to understanding the conversation between the patient and the doctor, and then segmenting it to segments. Taking the parts. The AI is smart enough to take the parts from the conversation, dividing into chief complaints. Typically, the SOAP part of the EMR. So dividing into chief complaints, assessment, lab investigations, the medicines, even BD, ODT, ID, and all, and then obviously the plan of care, even the cross consult part of it, very well handled by conversation. But I think still early stages, the confidence of the clinicians needs to be built, because still we have a lot of inclination towards moving to a system which also offers a handheld device. You write on a pad and then it gets converted into a digital prescription. So that is one very important part. That's a behavioral change people are slowly moving to. Yes, like how do you ensure EMR compliance across teams, and what strategies have helped improve compliance over time? I think I will share few of inputs of mine, because typically on day one, you will find out of the 100 or 200 prescriptions being generated, 50, 40, 30% compliance, right? And, in the previous companies, we have evolved in 6 months' time from a 30, 40% compliance to a 95% compliance to the OPD prescriptions, right? It has had happened over a period of time, because day one, the system is there with the person, then the inputs come. It all depends how soon IT can handle those changes, how beautifully they can train and retrain the audience again on the system, and how smart is the system to give a confidence to the user that whatever additional features or whatever additional changes are required in the system are quite achievable, because one size doesn't fit all. It's a different requirement of a EMR for a cardiology, it's different for a onco daycare, it's different for a pulmonologist, it's different for an ortho altogether. It's again depends on the beauty of the clinical templates that we define in the system. I think a lot of work goes into the design of a EMR. How do we design specialty wise EMR for all the clinicians? That is one thing that really helps for a smoother implementation down the line. I think that is the way compliance also increases, because the sooner doctor starts using it, let's say three patients on day one, then all patients on day 10 or day 15 maybe. But it's again, I think you cannot be very authoritative in that, but it is how much comfort and space you give to the clinicians, and then you have to convince them that you have designed the system for them itself and for their comfort as well as the patients. I think the way they see the beauty of the system, right, with the follow-ups in a month's time, they see how they see the follow-up data, how they see the reports, trends, how they see the vitals, how they see the improvements over a quarter. Example for diabetic patient, the compliance to the treatment and the predictive reduction in the result values of the HbA1c and all. That is a very pleasing experience that the compliance changes over time, and it's a participation from the clinicians also, whether they are comfortable with the existing, and how do they challenge IT with their changes coming in, and then still it is in the reference to the compliance that is required. Again, on top of that, I think it is the empowerment that the patient also gets from the EMR data. They also become very informed about their health, especially with the chatbots coming up, which are thoroughly integrated to the EMR. So it really is a boom how the patient care in the OPD is being handled with the use of EMR. Right. Your thoughts, sir?
Sakra, it's a Japanese venture. Toyota, everybody knows, and Sicom Healthcare. So they have a chain of hospital in Japan. They believe in technology. Even I think we have a 6, 7 robots and three Tesla, MRI, all those cutting edge technologies. So when this hospital started February 2020, 2014, then they asked from the day one, EMR should be there. Then IT team approached doctors, tried a lot. We started with 5%, reached to 25%. Then it's reduced, and somewhere 12 to 15% it's got stagnant. Scrap that EMR, brought one more EMR. That also somewhere 25 we reached and again stuck. So that was the mindset kind of. Okay, no, I can't spend much time on the computer. I am comfortable with the pen and paper. So those things were there in 2016, 18, 19, all those. When COVID came, then technology, few hospital already enabled all those things like telemedicine, and few hospital were doing in that time firefighting mode. Luckily, in 2019 only we done all those things. So they utilize those things during the COVID and then realize the strength of IT. Then now we reach to 60 to 70% of OPD EMR and 99% of IPD EMR. Means only consent form, because NABS says it's still the signature required from the patient side. So that's why we are on the consent form, we are taking on the paper. Rest are like doctor prescribing for IP patient in the system, and then request going to the nursing and pharmacy coming, material coming in the system, nursing doing the administer in the system. All those are happening in the system. So that cultural change, but that took time. It is not like day one we did.
Yes, yes.
So
It's a
it,
3 to 6 months journey for a typical compliance, and then maybe for other heavy OPD, the bigger challenges with the consultants who have to see almost 100, 120 patients a day. So it again depends on the patient load also, how your patient
correct.
load is distributed over the day, to which, you will find the EMR compliance.
Correct, very true. So it took time, and then we reached to this level. Still, we have to evolve. Means remaining that 30 40% doctors, and then we did strategically. Means management push, doctor personal touch, and then we are spending 1 week with one doctor, and then saying, "Sir, you tell us what exactly you require. You require order set, you require favorite, or you want some customization in this template." Then this way we slowly reached. So the doctor who's doing even maximum OPDs, he also started. Correct. So earlier we felt like older age people not doing, only younger generation doing. But in Sakra we realized no, it is not like that. It's a mindset. Even we have a 70-year-old doctor, he is doing every patient in the system. So kind of mindset you have to change. You have to be their right hand in the support of technology. Yes, means this asset gadget we provided tab, we provided all in one, so that they no need to go here and there. In one window they can achieve the objective.
Even in our case, also we moved on from our traditional screens to big size screens, almost 29 inches of it, medical grade monitors, so that you get everything in one piece. You get the lab reports viewing, you even get the X-rays viewing in that. So it is again, how strong you build the AMR integrated to your tertiary systems as a lab, radiology, and other things. That actually is the power where doctor knows that he doesn't have to look at 50 things. It's just one screen and the care is there. I think that is a bigger factor. And then a word of mouth is also there. As the word of mouth spreads, some doctors become your ambassadors of success. They share their experience with the peer doctors, how what is their success story and all. I think that's a bigger factor of the compliance overall. Well said, sir. I think we will move to the next question. So, how EMR has helped us to move towards a more patient-centric approach and empower patients with access to their health information. Okay, I'll start first on this. I think first and foremost, people have to understand, with the handwritten prescriptions, it was a very difficult task for even the smartest of the people to decipher that prescription. The patient even didn't knew what is written as the medicines in the paper-based records, and it is only the smart pharmacist at the hospital reception or maybe the
Only
outside
only
that
two
they can
people
know
can read.
what is it.
Only
Forget
two people
the
can read it. One is doctor, it's himself or herself, or pharmacist. Otherwise,
or maybe the pharmacist will take a picture and send it to the doctor. So what is this?
sometimes that also happens.
Yeah. So I think that is first and foremost that it gives a very good feeling to the to the patient. Patient feels what is the output. Patient will book, use a digital channel to come, or wait for some time for a doctor. It is like a report card to him that he visited a doctor. Especially for new patient, you will see he'll come in the morning, he'll be written some lab test, he will wait for the reports till the evening, and then when the results come and he sees, okay, these are the parameters that are wrong with me, and then this is the intervention we are looking at, these are the medicines that have been prescribed, right? Again, on top of that, let's say that tomorrow he's planned for endoscopy in a gastro and all. The patients are very comfortable with the digital initiative, everything coming in, their appointment been booked, but all these things coming onto a paper are quite scary for them, right? So I think digital initiative, a proper digital format, properly defined prescription format, what was your problem, what did the doctor find, or what are the lab results that were advised to you, what were the results, what are the medicines being given. I think it gives a very clinical approach, it gives a very confident factor to the patient, that yes, he has been properly looked upon by. I think the quality of prescription, the digital MR defines the level of care you provide to the patient. So I think that is very patient centric. And again, on top of that, with the bots and all coming in, we are anyways sending all OPD prescriptions on PDF and all. So now, even when the patient is coming for the last 1 year, fourth, fifth, doctor is very clear with the record with him. The precision of care is next level. He knows what did he order as the medicine on first day of the year. Let's see if we are sitting in December. So over the last six consultation, I'm talking about lifestyle diseases, cardiac problems, PTCA
Hmm.
or
Hmm.
diabetes and all, which are lifestyle diseases and all. You will eventually see, the high doses of medicine coming down to lower. How good is the compliance by the patient, in medicines, in terms. So holistic approach, you will see towards better and evolved patient care, because the doctor knows, looking at the lab reports, looking at the records, which medicine to increase, which to decrease, which to lessen. Eventually, there will be much better health outcomes when we move to a digitally empowered medical system as compared to a manual system. Sir, your thoughts?
If any project initiated by the IT or CIO or in this technology department, then which I felt like in my experience, usually user said you brought, you take care, correct. So it's just going the somewhere its adherence is there little bit and then going into the scrap box. Now approach is changed. we have to involve the management. Means first business decision, means what exactly organization want to achieve. Then only we can achieve these targeted. IT can support, IT can bring the best solution, but the adherence going to happen by the users. If users are not ready, then it can't survive. Means that that EMR, whatever technology you say, that can't survive. So here we taken that challenge and make the process, means whomsoever having the process owner, we will add all those points into his or her KRA. Then adherence will come. Then technology, actually we will utilize the technology and get the proper outcome from out of it. We are talking about on EMR. So EMR not only prescription, EMR electronic data of the reports like lab investigation, radiology, even it is this much precise. If in the impression of radiology they mention critical, based on that word, system throw alert to the doctor. Earlier, no, nothing was there. Means report came, printed, going to patient, then patient coming back along with that report and doctor seeing, then doctor can take the action. Now, on the minutes, doctor can take the decision because patients either show or
I
not
think
show, doctor will getting that report.
so. All critical alerts are designed that way only. That LIS are so smart these days that for OPD and IPD, any of the
LI,
parameter hitting clinical alert, we are sending a SMS and a mandatory call also going in. So these are the beautiful
so
interventions
LIS,
tech has done for care.
LIS actually the most of the value are objective, correct? But in radiology, it's a subjective. So based on subject, they are throwing the alerts. Means system day by day getting smarter. All those things are there. Apart from that, that also I think currently they are just guiding, insisting healthcare to come on the EMR to make your hospital digitalize, which I feel later 1 year or 2 year they will make it comply, like you have to comply with the digital data. So
Totally,
before
totally.
that we have to be make ready ourselves. Otherwise that particular healthcare will be in the trouble.
I think government will be looking forward to start with, most of the hospitals handling CGHS, CGSH patients. So they will make it a bigger compliance. So I think now is the time to be ready to handle all these things. I think, sir, we will move to the fourth question for the day. So in what ways has EMR improved hospital conversion matrices such as OPD to IPD conversion, follow-ups or repeat visits? Okay, on a very short note, I don't take much time into it. See, now you see all the EMRs, they are quite smart enough. Typically, they do a due diligence once the record is also created, right? So, doctor advises lab tests, uh, radiology, pharma medicines, or some procedure and all. Now, the smart system, how they are built is they define a task engine there for the GROs there. The GROs know that okay, once a prescription is received, these are things. So they have a far better approach, how to convince the patient that and because it is not for the business point of view, because obviously all top hospitals are NABL compliant, and the power of diagnostics with hospitals is that only that smaller labs don't are not that reliable as compared to NABL labs and all. And again, with the way pharmacies being controlled, hospitals are under the control of the drug controller and all, which is not so much in case of the local pharmacies. So I think that gives a better benefit to the patient when availing those services from the hospital and the pharmacy and all those things. And then again, the follow-ups, because system is designed that way that from that moment only user will be able to book the repeat appointment for 1 week from now or month from now, so that it doesn't go out of it, and the system is anyway smart enough to give a reminder a week before the appointment. So I think the way EMR has worked is, it has ensured patient compliance, as well as, somewhere customer loyalty also it has worked, because typically hospitals suffer with no shows or repeat customers, or, customer visiting one time or not. But this is a bigger initiative, which will actually help hospitals, to have repeat patient. Acquisition of patient is easy, but then, retaining the patient is a bit difficult. But this is one initiative which actually help more on the retention part of the patient. Your thoughts, sir?
Yeah, very well said. Because if visibility is there, then only you can take the right decision. If visibility is not there, then we can blame each other. Like EMR data. EMR data, once doctor is prescribing and sometimes saying, okay, you go to ER and get admit. Patient, no one carry means no one escorting that patient to the ER. They went there and they inquiring the doctor said like this, to whom need to contact. Nurse looking to doctor, doctor looking to someone else,
Yes.
and that complete chaos is there. So most of the cases, either patient frustrated, they are calling back to doctor, or sometimes they leave from the hospital without getting admitted. Leave it, we can admit somewhere else because here nobody is taking care of us. So those things we can mitigate with the EMR data, because it's flowing real time to the dedicated somewhere we called floor manager, somewhere we call SLM, somewhere we call coordinators. That data flowing to their mobile, and once doctor prescribe, like they are mentioning, okay, you admit or you admit tomorrow, then and there those coordinators making call with patient, making them comfort, sir, tomorrow this time you can come and these document need to bring, or today if you are getting admit, I am coming, I am helping you, or I am assigning someone to help you, because data visibility is there. Earlier on paper there is no visibility. So, experience getting increase, patient satisfaction getting increase. If we talk about hospital side, revenue leakage, we are stopping through this. So, all aspect it is going to help only. But thing is, to adhere, to implement, to make it successful, management push, top-down approach is required, culture change is required, and we have to give the tangible, non-tangible benefits of EMR to the clinician community.
Absolutely, sir. Absolutely. So moving to the fifth question, how is AI influencing the way EMR solutions are being designed today? I will, give my thoughts first because I have been in my initial days of career worked as a product manager. I have myself designed products and all. Last 10 years have been more about a technology head or a CTO role. Now I see the way AI is leading the way how a clinical decision support system should have worked years back, right? So the initial intervention by the clinician based on the symptoms, you feed in the symptoms, you feed in the symptoms, you feed in the clinical parameters, you feed in the lab reports and all. I think the way AI works is like it actually gives a solid support, solid robotic support as a helping hand to the doctors, to zero down on, what exactly can be the differential diagnosis for this condition. And it's up to doctors actually, again, to trust the AI, although we as tech do work that. But I think AI in a better world can be the best clinical decision support system and actually improve the patient care to a very next level. It can avoid repeated diagnostics, repeated expenses, because with the minutest of the disease, minutest of the health details and parameters, it can zero down on the most probable cause of diagnosis. Your thoughts, sir?
Yes, these days AI, we can say till now little bit buzzword, but in future it's not a buzzword, kind of like EMR, RPA, bot, all those technologies proven now, and this AI also getting proven. Recently, last year, some November or December, we changed our packs. So this, I'm giving one example. So what happened earlier in legacy packs, we are doing like X-ray image gone to the packs, and then junior doctor, DNB or other doctor, they are seeing those report, and based on that picture, X-ray picture, they are drafting the report, and then that report and picture goes to the senior doctor radiologist. They again see, and then seeing any findings or report correction, and then finalizing. So this process, two step are there, and taking sometimes 1 hour, 2 hour, or 3 hour, based on the availability of doctor or number of reports. Now in new packs, what happened once X-ray is done, system itself annotate that particular portion, because, and based on that annotation, drafting the report, and report then junior doctor work is eliminated. Now Senior doctor has to have a look. Okay, this is the x-ray film, this annotated, okay, rightly annotated or wrongly, they can view in a few seconds, and then going to the drafted report, seeing one glance, everything is perfect, finished. So within a minute they can finalize the report. So this is the strength of AI. Or AI works on data, because
Absolutely.
their engine is data. So if we have a digital data EMR, because EMR also electronic medical record, so then we can implement AI in many areas. Correct. So this is the one of the example. So definitely this EMR is the future of healthcare. If we are not awaking now, then we will be way behind in future, and it may impact the in the form of penalty from the government of India, because they are forcing ABDM soon. Currently, they just formed and trying to use to the healthcare industry, and whatever data we were giving in the form of hard copy like prescription reports, discharge summary, all those we have to give in the electronic form to the central depository. From there patient can retrieve their data. So EMR is very hot and important process, I can say, because it's not only technology, it's a collective effort from management, technology, and clinicians. Then only we can achieve it.
Totally, Mr. Bhupendra. I think we come down to the last question, and I think what all we have discussed till now in all of the things, the last question is simply a summary of what all discussions we had from the start. How do AI, ML, and integrated systems work together to improve clinical and operational outcomes in your hospital? Okay, so typically I will again say, AI is still evolving in India. Systems will have to go a far-flung way. It is still a 2-year, 3-year roadmap for us. Still in India, we are trying to get the basics right. Get the systems digitized. Move the processes from manual to a system-based approach. So it's still a long way, but it is anyways proven. The way AI is working extensively on healthcare, how do integrated systems works. Very common, very good example you gave of the RIS. Most of the RIS packs now coming AI enabled. As soon as you take the scan, and they highlight what can be the issue, and what can be the similar changes for it. Same very smart LIS systems have been built. The machine values now when they come from the analyzer, so typically they narrow it down to what can be the conditions associated with the change of the clinical parameters. And again, it all has to sink in. There are multiple systems we deal with, so typically all have to be hand in hand, intergloved. Then only we can see a thorough outcome. But ultimately, it again depends the adaptability of the human manpower, the staff that is there on the ground, their literacy levels, nurses, doctors, paramedics, the hospital administration, and all. How do they adapt to the AI and ML? Do they see it as a helping hand, or they see it as a challenge or a threat? Right? It all depends on the perception of the health force to the changing healthcare technology scenarios. And the future is very bright. Obviously, 2 3 years down the line, the level of patient care as it is in India will ultimately change for the top tier hospitals ultimately. But then again, people have to have a very adaptive approach to technology rather than a reactive one. Thank you, sir. I will conclude my side. Final words from your side, sir.
Really, this healthcare is transforming in India. I'll give one example. When we watch the old movie, and then the doctor say like, "Oh, he's diagnosed with cancer." Then they ask, "Oh, take this patient to abroad." Correct. So all those things were there. Now we are seeing in our hospital, even across nearby Delhi, Mumbai, and Kolkata, other countries, patients are coming to India. Means the level of healthcare is transformed in India. So we have to adhere the digital record as well, which help them to access their record across the globe. So EMR one of the biggest contributor to transform the healthcare, to support the clinicians, to support their clinical decision. So every we would request every hospital, every healthcare chain need to look into and consider as a culture change. It is not like technology; it's a culture change. So with this
Needs to be
comment,
a top-down driven approach rather than IT starting the bottom and pushing
no,
everyone.
no. If anywhere it is starting by IT, it's not going to survive. Never, never. So with this comment, I will also say thank you. It's a very fruitful conversation, and hope it's good for the industry. Thank you.
Thank you so much, Mr. Bhupendra. Thank you, everyone. Signing off for today.